nabibilaukan po kami dito. Katulad po ng PhilHealth, kayo, PhilHealth, clearly, nabibilaukan po kayo sa dami po ng pera na pumapasok sa inyo. Kami rin po dito, nabibilaukan po. Hindi namin po malaman kung anong gagawin. Pero klaro po, na kailangan talaga natin i-adjust pababa talaga ang inyong sinisingil. Actually, yung basic na tanong, Mr. Chair, is ang taas ng sinisingil ninyo. Pero bakit ang konti ng isinusuka ninyo sa tao, di ba? So, tanong, since nandiyan naman sa inyo, bakit hindi nyo nalang taasan yung binibigay ninyo na benefit, di ba? Yun ang very basic na question. Bakit kayo hirap to increase the benefits? Yun ang elephant in the room.
Mr. Chairperson, Honorable Representative Kimbo, we have increased our all case rates across the board for 30%, Mr. Chairperson. We have increased our benefit packages starting last year, and even recently, Mr. Chairperson, we have increased the case rates on bronchial asthma and neonatal sepsis. There are also still packages that will be increased this year, Mr. Chairperson, as well as increase in the benefits covering and covered by the Consulta program, Mr. Chairperson, Honorable Representative Kimbo.
Regarding your inquiry, in inpatient package, there are about 8,000 case rates. No? Ito po yung kahit yung mga simpleng mga sakit, pneumonia, sakit sa puso at iba pa, it's about 8,000 case rates based on the International Classification of Diseases, no? Or ICD. Sa outpatient po, only one. With Consulta package. Ito po yung outpatient benefits po natin, yung pong check-up, no? Ito po yung Consulta package that was introduced by PhilHealth under the UHC because we prioritize preventive care. So ito po yung isa lang. In the Z package is about 18. There are about 18. If I may just enumerate some of them. Sige. Ito po yung medyo malalaking gastusin, no? Yung acute lymphomic lymphoblastic leukemia, 500,000 ang pwede ma-avail. With breast cancer, about hanggang 1.4 million pa, no? Sa prostate cancer, 100,000. End-stage renal disease, eligible for kidney transplant, 600,000. Pag bypass po or mga open heart surgery, about 550,000. Surgery for tetralogy of Fallot in children, 320,000. Cervical cancer, 120,000. So, as you can see, Your Honor, Mr. President, we have really leveled up also the benefit packages based on UHC, which the members now are benefiting at present, Your Honor.
Opo, so yung Consulta package natin under the outpatient packages, isa lang talaga. Magkano po yun? May amount yun?
The budget that is for each member is about 1,700, no? Yan po yung pang check-up po nila.
Yes,
The annual check-up. It's 1,700 per person.
So maganda po ito, no? On paper, meron tayong 8,000 diseases or illnesses covered sa ating inpatient packages ng PhilHealth. Meron tayong isang package under outpatient which we call Consulta package.
That is correct.
And we have 18 diseases or illnesses under our Z packages. And these 18 are most likely the grave or serious illnesses or diseases.
That is correct, Your Honor, Mr. President. Yan po yung mga
Maganda,
medyo
maganda,
complicated
pero
diseases or ano na.
But can the sponsor share his experiences with us as a public official? Bakit pa marami pa humingi sa atin ng financial assistance kung ang ganda na nitong ating PhilHealth packages tapos mandatory coverage naman ng lahat ng Pilipino?
Well, the Universal Healthcare Act is a 10-year program, Your Honor, Mr. President. It's still a work in progress, actually. It's on its fourth year of implementation, and it's designed to lower the out-of-pocket expense of every Filipino. Yan naman po ang talagang gusto natin, no? But just to give you background, prior to the passage of Universal Healthcare Act, the out-of-pocket expense of every Filipino reaches about 70%. Kumbaga, 70% ng gastusin pang medical galing po sa sariling bulsa. But now, upon the passage of UHC, in 2019, it's down to 40 pesos na ba? 40 plus. Below 50 pesos. Magkano? Now, it's about 44.7 pesos na po ang out-of-pocket expense. So, there's a considerable improvement, but still a work in progress.
44.7% siguro, percent?
Sorry, 44.7%.
Yes, Apo.
44.7%. So, sila work in progress. So, meron pa tayong, kumbaga, may 44% pang hinahabol, no? Bagamat na nasagot na po yung almost 60%. But some indigents, yung po may hirap, there's still 40% that they are still trying to cover, no? So, yun po siguro yung lumalapit sa atin for MAIP,
Hindi lang
and
po
some
mahirap,
medical
pati
assistance.
middle class. Kasi ang lapit sa atin, mga hospital bill nila, millions, 2 million, 1.4 million, 700,000. Ito pong ating amendment is talks about the HTAC can adjust the benefit package. Yun ang ating... But
That is correct.
who monitors the hospital billings, Mr. President? Baka nagballoon din ang mga hospital billings. Hindi ko maintindihan wala ring tigil ang hingi ng medical assistance. Yung pang problema nila is to pay their bills. Akala ko ba sinolve natin sa UHC? UHA.
The problem, Your Honor, Mr. President, is that we do not have a law, no, that will be able to monitor, no. The problem also, mostly with the private hospitals, yun po yung medyo lumalaki yung mga bills, no. Wala ho tayong batas na pwedeng mag-monitor kung talagang are they charging exorbitant fees or what. But we're hoping in the future dapat magkaroon siguro ng ganun.
Walang
But,
study ang
standard.
PhilHealth, Mr. President, na tinignan nila nung pinasa yung Universal Healthcare Act. Kumusta ang behavior ng mga hospital fees and charges?
Pero yung sa hospital ang concern niya kasi kung baka
Tapos professional fees, hindi yata covered.
i-increase na natin. At present, Your Honor, Mr. President, unfortunately, there's no study yet according to PhilHealth. What they do is just they're trying to increase the benefit packages so that it can help cover the expenses of members.
But Mr. President, if we allow the other side, there are two sides to the equation. If we allow the other side to also increase in an unregulated manner,
Dapat siguro separate.
wala siphoning, we are just siphoning off the system's resources, Mr. President, from one side of the equation to the other side, Mr. President. Pero ang tanong ko is PhilHealth the institution even concerned about this issue? Is it monitoring the other side of the equation?
Your Honor, Mr. President, PhilHealth now at present is trying to monitor, no, ito pong mga charges to what they call as shadow billing. So they have the data right now with regards to the rates and the fees that are being charged by the hospitals. Probably in a separate bill, probably we can look into this so that we can assure that there will be no overcharging and there's no taking advantage. No, after all, our aim is really to lower the out-of-pocket and the medical expenses of all Filipinos, Your Honor.
May we know who is now leading PhilHealth, Mr. President? Who is the leader of PhilHealth now? President ba tawag doon?
Yes, Your Honor, it's the President is now Emmanuel Ledesma, and as junior, and the chairman is the department, the DOH Secretary,
Yes, apo.
Your Honor.
For example, Mr. President, ito marami tayong binabanggit dito na packages, more than 8,000 na ito kasi isama natin lahat. Yung mga parents, for example, ng mga autistic children na lumalapit sa akin, saan daw sila pupunta? Are there packages for those with mental health condition, Mr. President?
Your Honor, Mr. President, that falls under the children with disability, no? So that's included in the package, and that's why we need also the HTAC this time that would study and recommend the rate. So yun na lang po yung that will be the crucial part on what packages will be given to those who have autism and those who have children with with disability. So yung HTAC din po ang it will be HTAC that will be determine how much they would be able to derive.
Meron po tayong binanggit kasi na inpatient packages 8,000, case rates, outpatient package 1, Z packages 18. Ito na ba yung suma total ng benepisyo ng PhilHealth o meron pa tayong ibang pinag-uusapan, Mr. President?
That's a total already,
okay.
8,000.
So yung sa mga children with disabilities, pasok sila sa inpatient packages?
Z benefits.
Sa
Your
Z?
Honor. Yes. Your Honor.
Under what category? Sa
With
Z?
children with disability. Your Honor.
Okay, how much is that? Paano magpa-avail mo? Alam mo ng mga tao yun? Paano ba-avail yun? Iramayin ba ko sa
Your Honor, Mr. President, we have the figures. Children with developmental disabilities, assessment is discharge assessment rate ranges from 3,626 pesos to 5,276. Yung assessment pa lang po yun. And then the rehabilitation therapy sessions, ito po yung mahal kasi tuloy-tuloy, it's 5,000 pesos per set, Your Honor.
per session? Parang
Per
ganun.
session.
And then may limit sa number of sessions?
May limit ba dito? Parang... Meron nga ba sa ano?
Paano kaya malaman ng mga parents? One session lang?
Your Honor, it's 10 sessions per year.
Nakalagyan 10. Hindi, saan mo na ko yun?
That's why, Your Honor, we need the HTAC to be able to review as per our amendment. So if there's a need to increase...
Okay po yun. Okay. Kasi ang reklamong umabot kasi sa atin yung number one, hindi sila aware at yung mga nagsasabing aware sila, hindi rin nila na-avail or na-access, Mr. President.
Yes, Your Honor, Mr. President, that's the dilemma that we have. No? Actually, the UHC has a lot of packages. Ang problema lang talaga yung information campaign. A lot of people are not even aware that they are already entitled to such benefits. Sayang itong batas na ito, no? It's a landmark legislation that we passed in 2019. I think medyo kulang na tayo sa information campaign. Even our OFWs, ito, sila po yung mga nag-react nung pandemic. Ang sabi nila nga, Your Honor, bakit po sila magko-contribute? Hindi naman sila makikinabang dahil nasa ibang bansa sila. Ang hindi po na sabi sa kanila that all of their families are already considered as members. So hindi nila po problemahin yung gastusin dito. Okay. So the time that we were able to visit OFWs, no, nagkaroon tayo ng in Singapore and Korea, yung po, no, hindi nila alam. But when we were explained that their family members are now considered as members and they can already avail of this packages, pati yung packages na naikwento sa kanila, ay nagulat sila. So, on that end, Your Honor, Mr. President, I think nagkulang talaga ng information campaign ang ating gobyerno, whether it's the PIA, our networks, DOH, kung kulang lang tayo sa information campaign. People are not aware that the Universal Healthcare Act is already there, no, for to be able to assist all Filipinos, Your Honor.
Yung panukalang batas na pinag-uusapan natin ngayon, Mr. President, yun na sinabi ko, sections 9, 10, and 12 of the UHCA ang ating ina-amend. Yung UHCA ba, may section ba doon about the obligation of PhilHealth to let the public know about all the details of their packages as well as how to avail of the packages?
Your Honor, Mr. President, it's in the original law, no, yung pong 7875 or the National Health Insurance Act that is their duty to inform the public of the packages and the benefits, no, that they can be able to avail. Your Honor.
Kumusta compliance po, Mr. President?
The compliance. Well, according to PhilHealth, they are doing their best now for information dissemination. Actually, I was a witness also in Korea. They already have a PhilHealth representative that they send there so that they will be able to brief or at least disseminate information to our OFWs about the benefits that they can avail.
So I hope the sponsor will not mind if in the period of amendments, maybe we can revisit that original section on the obligation of the PhilHealth to propagate, to disseminate to the public awareness plus clear guidelines. But this time, lagyan natin ng ngipin. Lagyan natin ng ngipin. You know what I mean when I say lagyan natin ng ngipin. Actually, unfortunately, PhilHealth, that means may sanction. Okay? Yan po ang ating gagawin, Mr. President.
Well, that's correct, Your Honor. Actually, they said that they have already signed MOA with the Public Information Agency or PIA. Pero sayang kasi 4 years na po itong tumatakbo, Your Honor, Mr. President. Kaya siyempre
Which one, sir? Which one is the 4 years?
Itong UHC, no? It was passed in 2019,
Yes.
implemented in 2020. So we're in the 4th year of implementation. Kaya minsan siyempre nakakalungkot din, nakaka-frustrate din as the principal sponsor, with of course, Senator Tiberos, ang isa sa mga talagang nagtulak nito, one of the authors, no, of this measure. Tapos hindi alam ng ibang tao, nakakapanghinayang, sayang, di ba? Parang, siyempre, being authors of this measure, this landmark legislation, we're proud, no, that we were able to pass this, na talagang lahat magbe-beneficyo. So, yun po, I think any suggestion from Your Honor, Mr. President, that would improve information campaign, information drive, so that everybody, the Filipino people will be able to know of or avail of the services. Ang laki na po Even
Thank
the Z packages talagang nag-level up na. Yun hindi nila alam na ganun kalaki na po ang kanina makukuha.
Thank you po. But of course, we wish good health to all of our people. Na sana nga no need to avail of the illness related packages. Pero yung konsulta package, ano yata to? Preventive
Yes.
So, okay to, di ba?
Actually,
encourage natin, gamitin ito. Tama po ba?
That is correct. That's every member or every Filipino is entitled to annual checkup, no? That's why one of the salient features of the law is to strengthen the preventive side, no? Kasi po pag lumala na ang sakit, mas magastos, mas mabigat, hindi lamang para sa pamilya, mas mabigat din para sa gobyerno dahil ang gobyerno din ang sasagot kadalasan. So we are now trying to strengthen the preventive side by having this yung mga primary care, no, we're strengthening rural health units, yung mga super health, ano tawag doon? super health centers, no, they will serve as the primary care na bago po pumunta sa secondary and tertiary and apex hospitals, dapat doon na muna, no? So that's what we are trying to strengthen now, and trying to build more super health centers so that this will serve as the primary care unit of DOH for UHC. You know?
Mr. President, mabuti nga nabanggit natin sponsor yung Apex Hospital. That's why kinausap ko rin si Senator Bongo na para sa senior citizens natin, we want them to be also to be healthy. Ang tawag kasi ng branch of medicine for the elderly is geriatric medicine. Actually, walang Apex Hospital for that. Kaya sabi ko, and then I filed a bill for the establishment of the National Geriatric Hospital or Hospital for Senior Citizens. Sana kilusan na po ng ating chairman. Kinausap ko siya kahapon. That is. So, Mr. President, ito bang konsulta package, one size fits all ito? One amount?
Yes,
Magkano po ba ito?
It's 1,700
nabanggit na natin kanina, no?
per head as per PhilHealth Circular in 2023, Your Honor.
So ano lang po ito? Parang interview lang ng doktor. Wala po itong mga blood works, walang blood exam, walang mga ECG, or wala po? O ano lang ito?
May kasama po.
Sitting down with the doctor lang po ito?
Meron po, may kasama
Meron.
ito po.
Opo. Sige, banggitin po natin para kasi ito po yung covered ang lahat kahit wala kang sakit. Ang ating ini-encourage nga natin na i-avail tama ba, or i-correct ako ng PhilHealth kung ayaw natin i-avail ito ng taong bayan, Mr. President, ha? At ano bang gusto natin dito na kahit wala kang sakit, maganda pakiramdam mo, gusto natin mag-avail sila ng kanilang annual consultation and check-up with doctors. Tama po ba? For
Yes.
overall health.
Yes, that is correct, Your Honor. As I mentioned, as the preventive side, talagang this included yung annual checkup, which includes 15 lab tests and 21 medicines, Your Honor. 15 lab tests. Ito po,
Okay.
from our USEC, Albert Domingo is here with us. Ito po yung select laboratory and diagnostic examinations, including the PhilHealth Consulta Primary Care Package. Complete blood count or CBC with platelet count, lipid profile, total cholesterol, fasting blood sugar, oral glucose tolerance, glycosylated hemoglobin, creatinine, chest x-ray, sputum microscopy, electrocardiogram or ECG, mammogram, ultrasound, urinalysis, pap smear, fecalysis, fecal occult blood test. Tapos ito naman po na may mga gamot, no? So yung basic lab test, these are the medicines that are included. Amoxicillin, co-amoxiclab, ito may mga antimicrobial. Mahirap banggitin eh. So, oral radiation salts, fluid and electrolytes, salbutamol, anti-asthma, paracetamol, metomorphine. Ito, pati yung sa anti-diabetic, kasama rin po. And anti-hypertensives, no? Kasama rin po. Mga losartan, aspirin, parang Norvasc ito iniinom ko ngayon. Aspirin and others, antihistamine and antithrombotics, Your Honor. So marami rin po kasama.
Opo, 1,700 pesos po yung basic package niyan.
Per person, Your
Yes,
Honor.
bayad
That's
na.
correct.
So pero this is in the nature of a subsidy. If you're billed for more than the amount, ima-minus yung 1,700. Ganun po ba?
That's a capitation per person, Your Honor, Mr. President.
Yeah, is it in the nature of a subsidy? I mean, yung mga nakikinig sa atin, kunyari, pumunta sila, mahulaan nila kung sino yung mga accredited. Kaya tatanungin ko nga, ilan yung accredited laboratory. Kunyari, pumunta sila sa accredited laboratory or clinic. Lahat yung test na yon fixed at 1,700, hindi siya lalampas.
Your Honor, according to PhilHealth, it's performance-based, meaning kung ano po yung mga ginawa doon sa pasyente. So, doon lang po i-base yung payment.
Okay. So, hindi lahat yung gagawin. Yun lang mga posibleng gawin, and then gagawin up to the cost of 1,700.
Yes, not all people
Yes,
use all lab
yes.
tests. Eh. So
Yes,
I think those kung ano po yung makita ng doktor
Pag sumobra po na
kinakailangan.
1,700, out of pocket na po ng patient yon.
In government, there's no out of pocket. No? In private, there's 500 pesos. Maximum.
Maximum out of pocket. Why did we mention an amount na 1,700? Hindi ko makuha. If it's
Basic, both. Private and
What?
tapos sa private and in 500. Your Honor, that's the base, no? For both private and public hospital, 1,700. So yung 500 pesos is extra out of pocket. Kung sa private po, may dagdag pong 500 pesos. Kung sobra sa 1,700. Sa government, wala na ho. Kasi sagot na ho yan 1,700. That's
Sige po. But mayroon po kayong sinabi kanina na limited to the accredited laboratories or clinics. Ilan po ito, Mr. President? How many are these laboratories which will offer the consulta package of the PhilHealth?
There are about 2,161 accredited consulta providers, Your Honor, serving about 17 million beneficiaries nationwide according to PhilHealth. 2,161 po ang accredited providers. No?
Bakit nasabi pong 17 million? May 17 million na ang nagkonsulta, Mr. President?
The registered beneficiaries, Your Honor, 17 million. Your Honor.
Only the PhilHealth system, ako po yung nalilito na, PhilHealth system has 17 million members. 17?
17 million registered members. Tapos yung pong nakapag-avail na is about 5 million already. Naka 5 million na po na siya mula nung nagpasa po yung UHC, Your Honor.
Okay, but under the UHCA, all Filipinos are covered.
Your Honor, that is correct. Under the UHC, all Filipinos are considered as members, but they have to register so that they will be recognized as members by the doctors. Kailangan lang mag-rehistro.
Okay, so dapat 17 million pa lamang. Sayang, itong konsulta natin para sa lahat.
Sa consulta package lang, Your Honor, 17 million pa lang po yung nakapag-register.
Oo nga, pero
so they have to register.
katulad na nasabi natin kanina, gusto natin halos lahat.
Sana po.
Tama, no?
If hindi nila alam tama 'yun We need to improve on information campaign, Your Honor.
Itong 2,161 accredited clinics or laboratories for our consulta package, ilan po ang nasa Mindanao?
Ilan kaya? May breakdown ba tayo? Your Honor, Mr. President, as of now, the PhilHealth said they will just provide, they do not have the exact number, that they will just
Sige
submit.
po,
Your
at the
Honor.
soonest possible time para makita po natin. Okay, let's now go to the bill, Mr. President. Ang binibigay talaga natin is the power for HTAC to adjust the benefit package amount. So, kung wala pala ito, what is happening now?
Right, without the HTAC, Your Honor, Mr. President, it will be PhilHealth that would determine. So it is better that with the HTAC, which consists of experts, Your Honor, Mr. President, yung pong HTAC, at least sila po magsasabi kung kulang or
Yung amount,
kailangan dagdagan yung amount.
Ayun.
No? So these
So,
are
ngayon, it's the
experts.
board.
Yes, Your Honor, Mr. President.
How many people compose the board? Chaired by the
13.
secretary. Ha?
13.
13. Hindi lahat yun, galing sa government agencies yung iba?
Lima yung galing sa government.
Pati nga, compare na natin.
5, Your Honor, Mr. President, 5 ex officio comes from the government and the rest are experts.
Si HTAC, ilan pong composition nito? Council ito eh. Ilan ang HTAC? Council ito. Ilan yan?
With HTAC, Your Honor, Mr. President, it's 9.
9.
9.
So, 9 all experts in,
Yes, Your Honor.
ano siguro yan, different.
Specialists, experts, economists also,
So,
social scientists.
so ang policy decision natin dito, it's better that the HTAC will determine the amount for each benefit package rather than the PhilHealth board. Ganun yun. This is the change which will happen, tama? Just for me to understand.
According to Yusek Domingo, we are asking the HTAC to determine if the amount is enough or it needs to be increased. Kaya nga, they have the expertise, no? Kasi nga po,
But who actually increases? The board or the HTAC?
the board, Your Honor. It's the HTAC only recommends.
Review lang.
Review and recommends.
Okay, well, kahit wala
Review
siguro,
and assessment. And,
kung wala tong amendment na to, ibig sabihin, no, the board does not consult the HTAC.
Usually, the board only recommends data or gets data from the actuary, no? So, at least with the HTAC now, it's an external check and balance that was designed under the UHC. So they will be able to, as composed of experts, as I mentioned, so they will already say that they will have the say if it's enough or not, or if there's a need to increase. So yun po ang papel talaga ng HTAC.
Hindi makakilo si board pag walang recommendation si HTAC. Under our bill, not under present law. Ito, intention, what is the intention? Hindi magalaw ni board ang benefit package kahit pataas o pababa if the HTAC will not recommend it.
They can still act on their own, Your Honor, the board, but the HTAC is, the function is only to review and assessment. So it's better that
Okay.
it is better if they will be consulted.
Okay, so no effect on the power of the board. Actually, we are giving a mandate to HTAC to do something. May duty sa HTAC,
Yes,
which is
that-
to shall review and assess each benefit package.
Yes,
Ganun po.
that's correct, Your Honor.
Binibigyan lang natin ng trabaho, mandatory trabaho ang HTAC. No effect on the power of the board.
That is correct, Your Honor.
Sige, okay. Klaro, Mr. President. Ngayon, Mr. President, on page 2, line 5, lines 5, 6, at saka 8, meron tayong mga deletions. Meron tayong strike through, meron tayong strike out na mga words eh. What would be the effect of these deletions, Mr. President?
Parang amnesty yan, sir. Kasi yung mga hindi makabayad.
I am referring, ito na lang po, so that the records will bear what I'm referring to. Page 2, lines 5 to 6, pinapadelete po, and self-employed direct contributors, and from lines 8 to 9, the phrase, and not exceeding 1.5% for self-earning, professional practitioners, and migrant workers. What would be the effect, Mr. President?
Yes, para mapadali yung pagbayad. Para hindi sila mahirap.
Well, according to Yusek Domingo, Your Honor, Mr. President, this is to make it easier for the members who have missed their contributions. So, kumbaga parang magkaroon na parang amnesty, no? So that it will be easier for them to be able to pay yung pong kanilang missed contributions or arrears, so if you might want to call it, Your Honor.
But the effect will be permanent, Mr. President. Minamid natin yung law, dinidelete natin ito. This is not an amnesty. This is a permanent deletion, Mr. President.
Well, Your Honor, Mr. President, we will welcome any proposal for
But
From-
that is
for Your Honor.
that's the intention. Sana.
Yes, Your Honor. Yes, that's the intention to make it easier for those who will have their arrears, to make it easier for them to be able to update
Something.
their payments.
Thank you for that, Mr. President. Let's go to the second section of the law which is being amended. Ito good news, and I want the sponsor, if he should be inclined to explain this to the people. Ito yung maganda kasi napapansin ko parang yung premium rate sa PhilHealth contributions po ito ay binababaan.
Diyan palabas yun ulit.
Pinapababa po ng ating panukalang batas, Mr. President. So may we know from the sponsor ano po ang pagbabago nitong ating amendment sa Section 10 of the RA 11223?
Yes, Your Honor. You are correct on your observation. We adjusted the rates. Yan po yung naka-flash ngayon sa screen. At present po, dapat 5% na po, no, based on the Universal Healthcare Act. As I mentioned earlier, when we were drafting this law, it was based on circumstances prevailing at that time. Wala pa hong COVID na nangyari, wala pa hong pandemic. And again, we are all still recovering, although wala na po yung health emergency, but everybody is still recovering economically. So we are just trying to make it easier. Again, ang UHC kasi, we have to, sabi ko nga, it was not intended to be a burden, especially to the members. So, kumbaga, we will just, atras lang po natin ng kaunti. So, yung 2024 example na dapat 5% na, it will now be 4%, and then gradually increase it every year up to 5% in 2028. Your Honor. So, ano lang, it will just give the chance for everybody to be able to get back on their feet and to recover, Your Honor.
Yung 5% na dapat sinisingil na po sa 2024 ay madidefer hanggang 2028. Tama?
Yes, that is correct, Your Honor. That is correct.
Pero may epekto po ito sa ating mga benefit packages?
Wala po, Your Honor, Mr. President. Asan yung income? Asan yung income?
Wala po I mean, hindi bababa ang halaga ng benefit
Wala po,
packages.
Your Honor, Mr. President. Asan yung
Magandang balita po yan, Mr. President. Isang...
surplus? Makita natin.
Sige po.
Yes, because we also, during our hearings, the surplus of PhilHealth will be able to shoulder. Kayang-kaya po. Kung makikita nyo po, ito po, nandito na po sa slides, yung reserve fund po ng PhilHealth is enough to be able to sustain and to still continue to give the same packages, no? Kahit na po meron tayong adjustment sa rates, it will still be able to give the benefit and especially the packages. So kaya naman po.
Diyan po sa pinapakita ng ating sponsor na nasa screen, ano pong pinaka-importante po diyan sa tatlong ano na yan? Information na yan. Saan po kami titingin? Ano pong pinaka-importante? Si reserve fund ba?
Yung pong inflows, for example, wala dyan eh. Next slide please, yung inflows. Para lang makita natin that the adjustment of premium income will not have any will not have an effect on the income of PhilHealth. Yan pong nasa taas po, no? Yung premium income, if you can see it, from 2018, 2019, up to 2023, it has increased, no? Malaki po yung increase, no? 237.2 billion. Tapos po ito po yung interest and interest income nasa 21.5 billion. So yung pong expenses, sandali lang po. Yung po yung outflows, no? Yan po yung benefit claims and operating expenses. So kung makikita nyo po, the income or the inflows can very well cover ito pong mga outflows. So yan po yung net inflows na nandun po sa baba. So kaya naman po.
Magandang balita po yan, pero yung benefit claims, napapansin po natin na bumababa, Mr. President. Is there an explanation for that? 2023, 75.8 billion pesos ang benefit claims. lowest in 6 years, Mr. President.
Yun yung challenge. Kailangan pataasin ang
Did something happen in 2023?
Oh, bakit nga ba bumaba in 2023?
Ano? We will just defer this matter, Mr. President. I think the sponsor needs more time to get the explanation from PhilHealth. Siguro, Mr. President, meron pong good news naman at may nagsusubaybay din sa ating hearing at meron tayong phoned-in question na pagdating po sa oral health or oral dental health, meron ba tayong benefit package under PhilHealth?
As of now, Mr. President, Your Honor, it's not included yet, but it's being studied already.
Can we get an explanation? Bakit? Isn't that part of the overall health of the Filipino, Mr. President?
So, ba't hindi raw kasama yun?
Dito next ko. Pag resume nito, remind nyo ako. Ito. Kasi papasuspend ko na to. Anong term? Dental health? Hindi oral health?
oral health and dental saka optometrist on the one of so plano na po yan. Supply sa pipeline.
Pero yung present, meron sa
Okay, please.
Your Honor, Mr. President, according to PhilHealth and Ayusin Domingo, that it's part of the inpatient, no? Pero yung panghalimbawa, aksidente, ganun. But when it comes to the overall, yung pagpalinis, kasama, pero yung pong inpatient, hindi yung in-study pa natin. But the other packages are still under study, Your Honor. So, hindi pa lahat, no? So, it's being studied right now.
Ilan
by
taon
the-
ang PhilHealth, Mr. President? As an institution? Ilan taon na kayo, PhilHealth?
It was established in 1996, Your Honor, Mr. President.
So, alos malapit naman
29
30 years old.
Yes.
Niisip nyo pa ang dental package, Mr. President? Hanggang ngayon? Okay, alam ba ng doctors natin sa PhilHealth or the policymakers in PhilHealth that the overall oral or dental health of a person also determines his overall health situation?
That's correct, Your Honor. Mr. President, according to PhilHealth, that they will commit to already include as part of primary care, Your Honor. They're studying already, but they would commit to include it as part of primary care.
Lagyan natin ng ngipin yung commitment, Mr. President. Any time frame. Yung mga commit kasi, every budget cycle na-encounter namin yan, we commit. Pero can we have an idea, more or less, ilang months from now?
Yes, Your Honor, Mr. President, they commit within the year, 6 months to 1 year, they will include. They just include the decapitation recently, so it can be part of it, Your Honor.
Is there a dentist member of the PhilHealth board? Wala.
None, Your Honor.
Is there a dentist member in HTAC? Wala.
None, Your
So
Honor.
I think we foresee a problem there. So I hope you do proper consultations with our dentists organizations, Mr. President.
Yes, Your Honor, Mr. President.
So with that, Mr. President, if I could just suspend my interpellation because we have a question hanging, and then siguro we have a few more questions when we resume, Mr. President. Konti na lang, Mr. President.
Yes,
And then-
Your Honor, Mr. President, hopefully we can get back to you, no, regarding the actuarial projections, no, regarding your query, Your Honor. Thank you, Mr. President.
Thank you, gentlemen.